Hi, I'm Sachi, and I'm part of Dr. Jill McKee's research team. She was granted a grant from the KCNT1 Epilepsy Foundation to delineate the longitudinal phenotypes of KCNT1-related disorders. So we did this by using data from our local cohort in Citizen Health. We assigned HPO terms for all these individuals, performed computational analyses, and then rebuilt clinical histories of individuals living with KCNT1. So what is the HPO, or the Human Phenotype Ontology? This is essentially a big standardized medical dictionary filled with different terms to record and characterize clinical features seen in individuals with KCNT1. In our cohort, we had 58 total individuals. 4 were diagnosed with AD and FLE, and 52 were classified with EIEE, and then 2 remained unclassified. These are the most frequent phenotypes seen in our cohort on the left, and on the right are the 3 recurrent variants seen in our cohort across 2 different domains. So what were the most frequent phenotypes seen in the carriers of these recurrent variants? On the left, the individuals with their current variant 934 typically experience abnormality of coordination and apnea, amongst others, as denoted by the red dots. And on the right, individuals with the recurrent variant 474 experience abnormality of the oral and mouth physiology, or oral and eye physiology, along with the loss of consciousness. So in total, we had 706 unique phenotypic terms across 339 patient years. We then wanted to look more closely at the when individuals with KCNT1 began experiencing seizures. So we looked at our entire cohort and then split them into individuals with EIE and then individuals with AD and FLE. So the red dashed line denotes that 85% of individuals in our entire cohort began experiencing seizures by 1 year of age. And then seizure onset time did differ significantly between individuals with EIE and AD and FLE. We then looked at individuals with their respective recurrent variants and then their seizure onset, which did differ significantly between all 3. And then the red dashed line shows that all individuals with the recurrent variant 288 began experiencing seizures by 1 year of age. So then our next question was, how can we look at seizure severity and how seizure severity changes over time on a month-to-month basis for the first 12 months of life? So our x-axis shows the first 12 months from 0 to 12, and then the y-axis shows the proportion of individuals experiencing seizures and then their respective seizure severity. There's a lot of dark red. This means that many individuals experience over 5 seizures per day. The blue lines show a reduction in seizure severity. The yellow lines show an increase in seizure severity, and then the gray lines show a maintenance in seizure severity. And then the plot above indicates the number of individuals and their seizure histories per that given month. So now that we know a little bit more about the seizure histories of KCNT1-related epilepsies, we wanted to see how this compares to other genetic epilepsies. So individuals with SYNGAP-related disorders do have pretty severe seizures, but they start a lot later in life. The first 12 months of life, they're essentially seizure-free, which is quite different compared to individuals with KCNT1. And then individuals with SCN1A-related disorders do have severe seizures, but they're just less frequent compared to individuals with KCNT1. So KCNT1-related epilepsy does stand out for its consistently high seizure burden and severity compared to other genetic epilepsies. So then our next question was, is there a specific medication or universal treatment that could effectively manage these seizures? So the figure on the left shows the proportion of individuals that were taking a certain medication at a given age, and this is reflected on the figure on the right. So each dot represents an individual taking a medication at their given age. So you can see here that there really is no one universal treatment for managing these seizures. We then wanted to see if there was a certain anti-seizure medication that could either maintain seizure freedom for some period of time or improve seizure severity, meaning reduce seizure severity. So the ketogenic diet, levetiracetam, lacosamide, and clonazepam were all associated with either the maintenance of seizure freedom or the improvement of seizure severity. So all in all, the individuals with these specific recurrent variants did exhibit distinct phenotypes and time of seizure onset. And then these individuals with KCNT1 do have pretty severe and consistent seizure, or they have high seizure burden and severity that kind of stands out compared to other genetic epilepsies, but does inform and strengthen future clinical trial design. And then, so thank you to Dr. McKee's KCNT1 team, to the KCNT1 Epilepsy Foundation, to Citizen Health, to the Helbig Lab, and to the Children's Hospital of Philadelphia.